I know this thing is on, and I know that you can hear me. Nursing and healthcare needs advocates and activism. So what are you waiting for? Let's do the damn thing. Welcome, Sheena, to the Gritty Nurse podcast. It has been way too long before we finally figured this all out. A lot of back and forth, but finally today we are here sitting down, having a conversation. I'm so pleased to actually have this conversation because, just as we were talking just even before we hit record, therapy is so important.
Yeah.
So needed in this space. Maybe before we get started, how about you tell me a little bit about yourself, how you landed into nursing and how you got into psychotherapy?
Oh, what a great question. Well, first, thanks for having me, Amie. It's a delight to be here. And it's been really nice to follow your career path over the last couple of years. And so I'm glad we finally were able to make this happen together. So how I got into nursing was I loved to talk and I loved people. And my guidance counselor, because at that point there were still grade 13, and he said, well, there's some pamphlets in the library because it's before the internet. Go down and have a look. And the questions were, I can't remember from what, it might have been from the RNAO way back when. Do you like people? Do you like stories? Do you like to travel? There was a bunch of things. I was like, yep, that's all me. Opened up the pamphlet and it said, you could be a nurse. And I went, yes, just a lightning rod went right through my body. And then I realized that, I should probably get some math under my belt. I needed to get high grade 13 math and science and chemistry and all the things that really made my brain struggle. So I did that. It took me a while to finish nursing school, but I did it. And then lo and behold, had a pretty full career. I lived out west on Haida Gwaii, which is where my love and interest in full scope nursing started, and integrating mental health and into psychotherapy about 5 years ago. And just before COVID, I had decided that I wanted to go branch out on my own as an independent nurse psychotherapist. And then COVID hit, and I had a boss that was like, well, you can't call yourself a nurse psychotherapist and blah, blah, blah. And I said, okay, I think I'm done now. And they offered me a job that just wasn't going to suit what I needed. And so one day in my bathtub after I'd quit, I was laying there and I thought, when have you ever listened to anybody tell you no? Like really, truly. So I was in my bathtub and I just put a little Canva post together and said, guess what's coming? And then I launched my personal and private psychotherapy practice. And then from there, I've built Acceptance Clinic, which at this point, as far as I can tell, we're the only full service mental health clinic in Canada that is owned and staffed exclusively by nurses.
That's amazing. I mean, I can quite understand the whole hey, why am I doing what this person is asking me to do, or saying, hey, I'm not going to take this opportunity. I think I can kind of relate to that.
Yes, I think you can just a little bit.
And
yeah.
but I think that's so important, right? Like, I think again, nurses, we tend to put ourselves in boxes, and it's just like, here are the defined edges in where you can be. And I think that is like,
yes,
completely wrong. There's so much we can do, so much we can get into, so much knowledge that we have to share, that why put ourselves into a box. And I think it's kind of intentional. Like I talked a little bit about in my talk just recently that, I feel like the system intentionally designs for us to be in these boxes.
I think
the sooner we realize our power, our knowledge, and the ability for us to do things well outside of these parameters that have been set not by us, but by others, the sooner we really can tap into that power as nurses. And I want to hear a little bit more about nurse psychotherapy. I think some folks might be like, hey, what is that? How do you get into it?
Yes.
And I think you are the best person to talk about that. So why don't you tell me a little bit about nurse psychotherapy and how do you actually end up and land in a role like that? And I'm so glad you decided to do this, by the way.
Well, nurse psychotherapy in its basic form, if you just want to sort of go with a basic understanding of it, it's a nurse who has the knowledge, skill, and judgment to perform the controlled active psychotherapy. All the nurse psychotherapists I know have taken extra training in modalities. They've been mentored through their practice, and they're able to provide those interventions in an independent way. Or some of them also provided in hospitals, in clinic care, in private practice. There's lots of different places that they find themselves. So that's sort of the basic part. What we get is that oftentimes people get really surprised that nurses are in psychotherapy, and they'll say, nurses. Nurses can be psychotherapists. Lots of people are surprised when they think about nurse psychotherapists or nurses in psychotherapy. And I think that comes from a system that's really happy to rely on nurses' mental health skills, but they're far less willing to recognize them, to reward them, or bring nurses into mental health leadership. So it's not necessarily a place that we see very widely as nurses being able to provide solutions to what's happening currently in Canada. And I think it speaks to how poorly nurses are understood, just as you'd mentioned, in terms of what we can do and what we're actually capable of and the spaces that we can practice in. Yeah. And, the problem isn't nurses' capacity for it. The problem is that the system doesn't fully still know how to name it or value it or respect it.
Yeah, and I feel like that's a lot of various different areas in the world of nursing. Like we could go on and talk about like nurse practitioners and
Yes.
the ability to be working in that primary care space and just the whole, I'll be honest, like a monopoly on care. It's just kind of like I think to myself, I'm like, no one's trying to replace anybody, right? I think there's this
Yes.
fear of
Yeah.
like, oh, they're coming for my jobs. It's kind of like
Yes.
we
Yeah.
hear some of these echoes of this type of thinking and framing. And it's like, no, at the end of the day, if we have a primary health crisis or mental
Yes.
health crisis, why do we not use all the tools in our tool belt, all of the various different care providers that can help in these areas and really have an integrated system where everybody is working to their full capacity? No one's trying to take anybody's job. No one's trying to step on
No.
anybody's toes,
Yeah.
but we're trying to
Yeah.
ensure that everybody who deserves to have access to care receives care in a timely and efficient manner. And
Yes.
it begs to question, Sheena, what are people
100%.
really concerned about? Is it a monopoly on
Yes.
power, privilege, positionality in the healthcare
Yes.
space? Or is it really about making sure that everybody is seen and heard and taken care of? Anyways,
Yeah.
that's my soapbox.
I totally agree with it. And I think a lot of what nurses do, and especially in the mental health space, is that mental health is integrated into everything we do, everything.
Right.
And
Absolutely.
that nurses get their skills flattened into these soft skills. And when it's actually, high level clinical, relational, emotional labor, that's exactly what it is. And it depends on it. But it acts like it's really ordinary, as opposed to exactly what it is, which is complex skills and is valuable work, really valuable work.
I would never disagree. And I think it's for us to like let the
Yeah.
public know. Cause again, like I think the public's
Yes.
really, of course, informed by who makes the headlines, whose power and voice speaks, volumes. And I think this is why it's important that we get out there and we share our stories and what we can do and really share that knowledge and expertise so the general public is aware that, hey, okay, there might be a different provider I might be able to see in collaboration with this other type of provider. That there's not just here's the only way that you can receive care, whether it's for mental health or for primary care. This is the only pathway, when we know that there's a variety of different pathways and that always the care in the approach is collaborative.
100%. Yes.
I don't have to sell it, but again, at the end of the day,
It begs repeating.
Of course.
It begs repeating. Yes.
Absolutely. So you founded Acceptance, which is recognized as the first exclusive nurse-led psychotherapy clinic in Canada, which is an incredible milestone, but also means that there is no blueprint. When you're standing at the edge of launching this, what was the loudest systemic barriers or internal doubts that you might have had, and how did you decide to build the space anyways? Well, because we need it. I mean,
what a great question. The straight up answer is because they told me I shouldn't. And in my nursing career, what I've discovered is that when people are questioning out of the box thinking, is usually when we need to press in harder. And when I was looking at the nurses who were attracted to nurse psychotherapy, these were nurses that were also wanting to leave the profession and losing their skills, their knowledge and skills, and the diversity of what they could offer just seemed really sad. And also I saw in my own private practice how much people really benefited from having a nurse psychotherapist. And I had a wait list in 6 months. And that told me that something was going really, really well with the way in which I was approaching therapy from a nursing lens. And so I invited somebody to join me, and he was really excited. He comes from like a street nursing background, so he could use his skills around substance use. And it was forming that relationship. And then it just snowballed from there. And then nurses were reaching out and saying, can I join? Can I get mentorship? Can I practice with you? And it just kept feeling really positive and making a really positive difference. The struggle has been not from the public per se, in terms they really seeing nurses as a valuable opportunity, valuable care. It's been from insurance companies that we've had the most fight. And also, that idea of the private public sphere, it's been a bit of a challenge, but I experienced in advocating for patients that when somebody starts to put their hands up because they just don't want to do the work or they don't understand it, it doesn't mean that it's not the most right way to go. So I just did some grassroots. I'm not going to let you say no to me, and we're just going to go ahead and do it.
Right. So I'm going to back it up a little bit because I do want to talk about the insurance gatekeeping battle. But what does it take to become a nurse psychotherapist in Canada or Ontario?
Well, sure. So nurse psychotherapy is recognized in Ontario. And then there's also other places, other provinces have different names for the nurses that provide psychiatric care or mental health care. So for example, in British Columbia, registered psychiatric nurses, and that's similar in other provinces. So you have to have graduated from a recognized accredited institution. So a college or a university. You can be an RN or an RPN, and then having taken modalities and been trained in those, mentored. There's a list of what do you call them? Practice guidelines or standards of practice through the Nurse Psychotherapy Association of Ontario. But generally speaking, what I do see is that nurses get into this after they've had years of lived experience. And so when you say what does it take? I often say to people, nurses have heard everything. They've seen everything. We've smelled everything. And in some cases, tasted everything.
Oh dear.
And we're with people from womb to tomb in the most joyous, tragic, moments, devastating moments of human life. And that depth of human understanding is what it takes to be a nurse psychotherapist. And that it comes from that repeated, intimate exposure to real life human beings. And it really matters in psychotherapy because good therapy isn't just about academic knowledge. It's the ability to read people, stay grounded, hold hard truths, and be able to be in relationship with people, which is what nurses do best. And so when I have rarely experienced somebody coming directly out of nursing school and saying, I'm going to be a nurse psychotherapist today. They have years of experience under their belts of seeing people across all different ages and stages. And then they've taken modalities and then they've added to their practice. I mean, how we always do it as nurses, right? I'm curious, I'm interested, let's get more training. Yeah. Does that answer your question?
No, that does answer my question. I mean, I think, again, I know that, I guess when I think about how nurses sometimes think too, they're just what's the direct route? What are the specific things that I have to do? But I think as you've described it, it's kind of a little bit more of you've been practicing for some time. You might have thought about nurse psychotherapy, and then you start going down the route of educating yourself and what does nurse psychotherapy do? What do they do? What other courses or things that might be aligned in terms of that mental health underpinning of work, and then you do your whatever other regulation aspects that you have to do, and then you can call yourself a nurse psychotherapist.
Yes, and there is an important distinction here, Amie, and this is not, for some people this isn't a popular opinion. There is a school in Ontario that offers something that's called a certified nurse psychotherapist. And many nurses that are going down that path of wanting to be nurse psychotherapists here in Ontario find that course. And some nurses have been led to believe that you need to be a certified nurse psychotherapist before you can practice as a nurse psychotherapist. And I want to be really clear here that the CNO does not recognize that college, doesn't recognize that distinction. The CNA doesn't recognize it at all. And there is no such thing legally in our regulations that is a certified nurse psychotherapist. That is a trademark. That is a trademark only. And that the only thing that allows us to practice is by being registered with the college, with the CNO. And I want to be
a very clear distinction.
Yes, I want to be really clear about that. I've had so many questions, and you can get the modalities and the training you need through accredited universities, plus being in community with other nurse psychotherapists. And many of us are mentors to other nurses that are just starting out in their practice.
Thank you for that clarification. I think
You're
that might
welcome.
help some folks who
I hope
are
so.
looking into doing this type of work, right?
Mm-hmm.
Let's talk about the gatekeeping. So just kind of circling back to what we were talking about. So I've seen many
Yes.
headlines related to CTV and across the
Yeah.
advocacy space where, massive insurance providers like Sun Life are actually actively denying claims for RN psychotherapists, essentially telling clients that they weren't or aren't qualified to do this work. So how do you feel and how do you see this insurance complex trying to
Yeah.
shrink our scope of practice, and how is your clinic fighting back so clients can so rightfully be covered?
Right. Oh, what a great question. So I have so much to say about insurance companies. So they often blur when our clients get rejection notices from their companies or from the insurance companies like Sun Life or Canada Life that are just to say it out loud, the two biggest deniers of nurse psychotherapists or psychotherapy provided by a nurse. They blur these two arguments. And I really think that matters because insurance deny claims because the provider is a nurse, but also they question whether the nurse can actually do the work. They'll say things like nurses are not able to provide that kind of service, or they have to be registered with this. The regulated psychotherapists in Ontario,
Okay.
the CRPO. So and whether nurses can do the work or whether the plan has chosen to allow to include psychotherapy. And that's a real problem because it's not that nurses can't do the work. It's that we're regulated and we're regulated and legislated. This is the thing that we have been advocating for at Acceptance. When we're talking to our clients about it, we give them letters to send back to their companies to say, why aren't you following the legislation, the RHPA that says nurses can provide the controlled active psychotherapy? Clear, very loud and clear. The CRPO also says the same thing. And I mean, beyond that, the CNO declares it, but then we're regulated to do it. And that is what we've been talking to our clients about. And that's what we've been supporting other nurses to talk about as well, is that it's not just that they don't get to say what we do. They can't just say nurses can't do that. That's not appropriate. They're choosing actively to ignore the legislation and to ignore our regulations. And so they also, when they deny coverage, it also treats it like proof that nurses can't do the work that they can do. Similar
Right.
in vein in that they won't cover nurse practitioners as well for various things. And it fits a larger pattern, right? The systems rely on nurses' work, but they're not willing to recognize it, even through our own pathways. How is it that you can deny that you can say that because nurses aren't on a special list that nurses can't perform the controlled active psychotherapy?
I wonder, who's making these decisions, but continue.
Well, and it's just it's an antiquated, delayed way of seeing what nurses can do. Truly, truly, if you look at who's been regulated in this province for a lot longer, it's not the RPs. It's nurses, right? And so our college has been around for a long time. And as a self-regulatory college, we have to understand if we have the knowledge, skill, and judgment to be able to perform that controlled act. And if we can't, we don't. And if
Yes,
we can, we do. And
absolutely.
if we look at it just an even one layer deeper, part of the people that are making the decisions are really, if I may, probably gendered, probably some old white dudes back in the 20s that just decided that like this is what we could do and then they're going to have to fight to get it changed. That doesn't make any sense anymore for our realities. And especially if they want their clients to be healthy. What are
Yeah.
they doing? Even if their policies, if their plan covers psychotherapy, why aren't they saying, but we're going to exclude nurses, so don't even bother? That's the more honest conversation.
Yeah, no, I agree.
Yeah.
I think this is
Yeah.
where maybe it'd be probably good for these news articles to do a little bit of digging, right? To say like who are fundamentally making these decisions to say no if they're not following the legislation. And I think that again, it just speaks to power privilege, deciding what nurses can and can't do, even when there's a framework showing that more we're more than qualified to be able to do this work. So definitely,
Yes.
I think something we need to take on
And if I,
and yeah,
yeah, and if I may, Amie, it's also what they're saying is women can't do that work, and women we still make up the majority of the work of the workforce in as nurses, and it's not lost on me that that's what they're denying.
yeah. But yeah, like again, I just think that, when we are thinking about nursing and the work that we do, this is why I've always said, we are the architects, the designers, the authors of everything that comes when it comes to nursing, right? If we
Yes.
are the ones that hold the pen, we have to be the ones to tell the story and not to let other people
Yes.
tell the story for us. So again, this is another example of someone else trying to hold that pen, and we have to be like, no, this is how it is, and this is what we can do.
Absolutely. I
And
agree.
I'm glad we're having this conversation so people are more aware of, what the actual legislation says. And I'll make sure that I
Yes.
put those into the show notes so people can do a little bit of a deeper
Mhm.
dive. I want to talk a little bit about some of the work in terms of psychotherapy that you do. Is there any specialized focuses that you have in your clinic?
Yeah, at Acceptance, we specialize in neurodiversity and also in LGBTQ care. It's not only what we do, but it is as a lesbian neurodivergent woman. When I started my practice, I thought, well, I better make sure that I'm offering it my lived and professional expertise here.
Absolutely.
Yeah, and we also we specialize in people with substance use as well, whether it's, they've been using for a while or whether they're in recovery. We offer that. We do virtual and in person. And then our nurse practitioners, we have a nurse practitioner who works exclusively with adults. And then we have another one who works with children and youth. And so we find that whole person care, rounded out with the medical parts as well as the psychotherapy parts, has been a real game changer for our clients, that we can keep all the care in house, but then they also have this team of nurses around them that are able to support them. We also provide care for couples. And in that, we provide couples therapy and sex therapy. And we have care for individuals and families as well. So each nurse psychotherapist has their own skill set and niche. And then we also provide care. This is brand new, and I'm so excited. We have Ana Rodriguez, who provides care exclusively in Portuguese.
Well, that's
So
so cool.
it's been wonderful. Yeah, it's been so wonderful. She's a IEN, internationally educated nurse who's come here. She's here, and that's all she's wanted to do is nurse psychotherapy, what she was doing in Brazil. And I was so happy that she approached me to say, "Can I do this?" So, oh my gosh, yes, please, because we have gotten requests about where to go for care in other languages, and it's a great next step for us to be able to support other nurses who want to provide that care in other languages.
Yeah, I think that EDI lens is so important, right? To make sure that there is diversity and representation within all of these various different domains. And I think it's so important that we recognize and actually, incorporate that. One of the things that I'm working on with the Canadian Nurses Association is helping support their
Mm,
reconciliation framework that's coming out this week. And just
amazing.
yeah, so make sure you
Yeah,
you tune in and you check it out. Really
absolutely.
making sure that, when we're thinking about all of the various different folks who need support related to mental health, I'm not forgetting that, there are those various different intersections and making sure that we reach
Yes,
out to various different patients, and various different patients can see themselves through your work and make sure that they say, hey, this is a welcoming space. And of course,
that's
June,
right.
it's Pride Month. So
Yes, yeah,
exceptional that you're doing that type of work. And then also just
yes,
the fact that you mentioned that there's folks in the space in relation to harm reduction. I think of all of, what's happening in Ontario, what's happening in Alberta, what's happening really just across Canada with the toxic drug crisis. And the fact that, there are sites that are closing down really based on not necessarily evidence-based models, but literally based in politics and personal
yes.
beliefs, not
Yeah,
grounded in anything ethical. And I
no,
think it's
or
problematic.
science.
No,
Yes,
right? It's just like,
yeah,
oh yeah, we're gonna close these down because we think we should just force you into treatment because that's how it
hmm,
really changes and how it makes things work, and we know that that's not the case. So again, I'm glad that you have someone that's in that space for harm reduction, because we need that. And I can only think about the stress and the additional burden that your workers will have to face and your psychotherapists will have to face because of policy decisions made by our governments, which
yes,
makes me want to
yes.
kick them in the pants. However,
Indeed, indeed. Well, and one of the things, just to circle back to what you said about the CNA's report that's coming out, did you say policy statement that's coming out? Is
it's
that
called the reconciliation framework. So it's actually
framework?
a framework really co-led by Indigenous folks right across all of Canada. The
Amazing.
Indigenous policy analyst Hilary Fry, she's a CNA's first Indigenous policy analyst, is leading this work, and it's
Great.
quite groundbreaking. Coming out Friday.
Well, that's so exciting. Well, one of the things that was really important to me, my very first nursing job was on Haida Gwaii, which is islands off the northwest coast of British Columbia, and it really shaped and framed my how I am as a nurse. And so part of my goal with acceptance was that we would try to reduce the barriers to access to mental health care for our Indigenous communities, for the Indigenous communities here. And so every single one of our nurse psychotherapists is registered with NIHB, and we take care of all of the back end because so much of the barriers are to being able to pay up front and then also submitting your receipts and getting approval. That process is so limiting. And so I was really committed to making sure that our administrative staff had put that in place and that all
Yes.
of our nurse psychotherapists are registered. And so we have some really wonderful relationships with First Nations communities, Georgina Island, Hiawatha, Curve Lake, where we're able to do that work together, which feels really, really good. And I feel really glad that we can get to listen in that way. And Luke and Laura, who are two of our clients who are two of our nurse psychotherapists that are going there and being able to support community. So it's an
That's
exciting piece
amazing.
of work to be able to offer that. Yeah.
Yeah, no, that's amazing, Sheena. There's about 5 minutes left, probably like 3 minutes for me because I got to run. But last words to you. What is it that you want people to know about nurse psychotherapy? Whether it's a nurse, whether it's a politician, whether it's a fellow individual who might be looking for help and support. Last words to you.
Amie, I wasn't expecting that question.
I'm sorry.
No.
Give yourself
It's
a minute.
amazing.
Give yourself a minute, and
Yeah. Well, I would say that nurse psychotherapists are different, not better than everyone else. We're just different and uniquely positioned to provide this kind of care. We bring a steadiness and breadth that comes from nursing and trained to see a person in a whole context. And if you have been wishing that your nursing practice could include psychotherapy, there is a pathway forward. It's not as difficult as it looks. It's not as, there's not the gatekeeping that you might be finding. I can help you work through that. There's lots of people that can help you work through that. But also, if you're a politician and you are serious about the RHPA, the Regulated Health Professions Act, having teeth in Ontario or even across Canada, that you consider making sure that insurance companies have to follow that rather than just deferring to the insurance companies to make the decisions about who's going to get covered for nursing care or not. And my encouragement is to follow Nova Scotia and Newfoundland's lead when it comes to the labor mobility laws for nurses that say that nurses who are practicing, who are licensed and regulated in another province can see clients in Nova Scotia and Newfoundland without needing to have a separate registration. And that is really important for the care of Canadians, allowing nurses and encouraging nurses to be able to do that work across the country rather than just keeping them in one province. We can do way more work altogether if we can flatten that system and use those labor mobility laws to be able to support the mental health of other Canadians.
Well,
How is that?
I think that's great. I think, again, this is where I've said it so many times. We do not need
Yeah.
to reinvent the wheel.
Mm-mm.
We can use the knowledge and skills from other provinces, take their learnings and be like, yep, of course we might have to adapt it for various different communities, but never to just have to redo the work, right? If someone's already doing some great work, take that knowledge and, make it ours or wherever the community is that there is. So I do know that we do have some politicians in the federal government that do listen here. And I know right now the federal government in terms of healthcare is working on a national strategy for boys and men because they need psychotherapy.
Yes.
And I think it's just important that, whoever is out there listening, if the end goal is to ensure that all Canadians have access to mental health, then we should make sure that nurse psychotherapists are on that list, that we can access care that in that way as well.
Absolutely.
So thank you so much, Sheena, for coming to the Gritty Nurse podcast. Always a pleasure to have a conversation. Thank you for listening and being able to, be gracious with me, because I know it's been a little bit of a struggle. But we made it today, and we made it.
Yes.
We were able to have the conversation. Let's stay in touch, and I'll make sure that. Where can people find you, Sheena?
They can find me at acceptanceclinic.ca or Sheena at acceptanceclinic.ca or Facebook, Instagram, LinkedIn, anywhere.
I'll drop all of the various different ways that people can find you. So again, thank you so much for having this conversation with me, and until next time.
Thank you so much, Amie.
Looking for a great gift for a nurse or someone who needs to learn about nursing? Check out my national best-selling book, The Wisdom of Nurses, Stories of Grit from the Bedside. Thank you so much for listening to The Gritty Nurse with Amie Archibald-Varley. If you're watching on YouTube or listening on Apple Podcasts, Spotify, iHeartRadio, or any other podcast platform, please hit the subscribe button so you'll never miss out on any awesome episodes from The Gritty Nurse. Thank you so much and stay tuned until next time. Stay gritty.